Hello, my name is Lilia Neville and I'm the Benton County Public Information Officer. A case that was previously identified as a Benton County COVID-19 case is actually a Lynn County case. This is the second time that this error has occurred, and for that we apologize. Today we announced our sixth COVID-19 case. A female in her 90s tested positive and is hospitalized. Information moves very quickly between health officials, and we do our very best to try and get accurate information out in a timely manner. But unfortunately, sometimes our urgency to distribute critical information means that we misidentify a case or make a mistake. To that end, we're going to follow a similar process that the Oregon Health Authority uses. Benton County is going to announce any new cases at 1 p.m. Monday through Friday. So earlier today at 1 p.m. we did announce that sixth case, the female individual in her 90s. And moving forward, that is how we will announce positive cases. Our update today is from Fire Chief Ken McCarthy, who is also serving as the EOC Director during this operational period.
Good afternoon. I'm Ken McCarthy, the Fire Chief of Corvallis Fire. I'm also currently filling in as the Emergency Operations Center Director 50% of the time. When I say Emergency Operations Center Director, a lot of people don't know what that means. So during a large-scale disaster, we open up what's an Emergency Operations Center. We bring in critical people from different resources, public works, finance, the fire department, the police department. So we have all the people in one room. We can make quick decisions, act on those decisions, and be more responsive to the emergency. For the pandemic that we're experiencing, we've opened up the Emergency Operations Center Monday through Friday from 8:30 to 5. We have 2 shifts, and we have just switched to working them 1 week at a time. When we first opened up the Emergency Operations Center, we were focused more on reactive issues that were facing the county. And I should say that the Emergency Operations Center is a representation of the county and the city of Corvallis. That is an unusual partnership, but due to the population of those two and the capacity, we have worked together to build an Emergency Operations Center. So the reactive pieces that we had to get to is inventorying our protective equipment, our personal protective equipment, the gloves, the masks and such that we had as a county, and then dividing up those equally to spread out how long those will last for our hospital workers, our fire department, our police department. We have gotten that inventory complete. We're working with a group of representatives to start distributing those out, and we're also reaching out to state and federal agencies to ask for additional resources. We have created a recovery portal through the Emergency Operations Center, and that is bentoncounty.recovers.org. That will be dealing with donations, volunteering, other ways that the community can be involved as this event continues to go on. We are working on getting information out. We're using the Benton County Health Department and referring most outwardly facing information to that. But the city of Corvallis specifically and the county have websites that you can link to from that site that will take you to actions such as the library closures and such within the city to keep up-to-date information on that. These videos are another source of information we're trying to release to the public. The Emergency Operations Center intent is to try to now look proactively at what could be coming in the future and start pre-planning for that. Some of the things we're looking at is having a larger demand for hospital beds than there are currently hospital beds available. So we're looking at alternative care sites. Where would those be located? How are we going to staff them? And how those type of issues would work. We're also looking at vulnerable populations, elderly that might be not getting the proper medications or food, the homeless population who may become infected but aren't severe enough to be admitted to the hospital. Where are they going to be housed for their recovery? So these are all issues that the Emergency Operations Center looks to address and try to get ahead of the need. One of the quotes that I heard that I really have enjoyed is, if we do our job correctly, everybody will say we overreacted. So we're pre-planned past the point of emergency and past the point of having to run around and try and chase down solutions, but we'd rather have the solutions in place. What precautions are we taking? So we are, both at the fire department and at the Emergency Operations Center, are checking every day our vitals. We're having it professionally cleaned in between every shift. We're looking at response matrices for the fire department. If the call volume goes up to what is anticipated as a possibility, how could we change our response model to meet those needs? So all those plans are being in consideration, and we do hope to continue to bring both the city of Corvallis and the county overall great service. We have created an outwardly facing email. It is eoc@corvallisoregon.gov. This is for people to submit ideas or questions or concerns. We are very busy there, so don't expect an immediate reply, but we have already taken several of those suggestions and put them into effect. So it's a great way of submitting your ideas. We do ask that as we bring up our volunteer and donation branch, we'll have very clear directions on how to volunteer and where to donate, but to work through the Emergency Operations Center versus going out and do-it-yourself projects and start creating things that may not meet the standards that we can have out in the field. So that cooperation will keep us from having to undo good intention, and it'll give you the proper direction to take your energy and volunteering effort. I do want to thank the citizens of the county and the city for helping us by staying separated, staying at home as much as possible. If we can slow down this curve of infection, it will give the hospital, our emergency workers, our public workers, our police, more of an opportunity to handle the call volume versus just having one quick peak where we are just completely overrun. So please continue to do what you're doing and stay safe, and appreciate everything you've done for us, and hopefully we can meet your needs. But again, reach out with any concerns.